History often repeats itself, but sometimes it rhymes. About 100 years apart, two great pandemics swept across the globe, changing life for everyone. The first was the Spanish flu of 1918 to 1919. It arrived just as the First World War was ending, spreading with returning soldiers. This virus was a type of influenza, but it was far deadlier than the seasonal flu we know today. It moved with terrifying speed, reaching every corner of the world. People felt helpless as they watched their loved ones fall ill, often dying within days. There were no modern medicines, no vaccines, and no antibiotics to treat secondary infections like pneumonia. Societies were left to fight the virus with simple tools like masks, quarantines, and public gathering bans. A century later, in late 2019, a new virus emerged, SARS-CoV-2, which causes the disease known as COVID-19. Like the Spanish flu, it spread quickly through human contact, traveling on airplanes and through our interconnected world. Suddenly, cities fell silent, schools closed, and hospitals filled up. The world felt a familiar fear, a sense of uncertainty that echoed the past. However, this time was different in many important ways. We had advanced science, global communication networks, and a deeper understanding of how viruses work. The challenge was immense, but humanity faced it with tools that our ancestors in 1918 could only have dreamed of. This new pandemic would test our modern systems in ways we never expected. The parallels between the two events are striking. Both pandemics were caused by respiratory viruses that jumped from animals to humans. They both disproportionately affected certain age groups, although in different ways. The Spanish flu was unusually deadly for young, healthy adults between 20 and 40 years old. In contrast, COVID-19 was most dangerous for the elderly and those with existing health conditions. In both eras, governments struggled to balance public health with economic stability. They had to make difficult decisions about closing businesses and restricting personal freedoms. These choices were often met with confusion and resistance from the public, showing that some human reactions to crisis have not changed much over a century. Despite the time gap, the fundamental human experience of a pandemic remained the same. People felt isolated, anxious about the future, and mourned the loss of normalcy. Families were separated, and communities were forced to find new ways to connect and support one another. The empty streets of 2020 mirrored the ghost towns of 1918. The daily news brought grim statistics about infections and deaths. These shared experiences connect us to the people who lived through the Spanish flu. They remind us that while our technology and knowledge grow, our vulnerability to disease is a timeless part of the human condition. Understanding this connection is the first step toward learning the lessons these events teach us. The scale of death from the Spanish flu was catastrophic. It is estimated that it infected about 1/3 of the world's population and killed between 50 and 100 million people. This was a staggering 3 to 5% of everyone alive at the time. In many places, life simply broke down. There were not enough gravediggers to bury the dead, and bodies piled up in morgues and homes. The world was already reeling from the devastation of World War I, and the pandemic added another layer of trauma. Economies that were struggling to rebuild were hit even harder. The loss of so many young working-age adults left a deep scar on societies for generations, changing families and communities forever. COVID-19 also had a devastating global impact, though modern medicine prevented a death toll on the same scale as the Spanish flu. As of today, July 18, 2025, the official number of deaths directly caused by COVID-19 is over 7 million. However, many experts believe the true number, including deaths from overwhelmed healthcare systems, is much higher, perhaps as many as 36 million. Beyond the deaths, millions of people now suffer from long COVID, a condition with long-term symptoms that affect their ability to work and live normally. The economic impact was also enormous, causing global supply chain disruptions and forcing businesses to adapt or close. The world changed in fundamental ways, just as it did a century earlier. The social fabric of the world was also rewoven by both pandemics. During the Spanish flu, fear and misinformation led to social breakdown in some areas. People became distrustful of their neighbors and even their own governments, which often failed to provide clear information. In the wake of COVID-19, we saw similar patterns, but they played out in a digital world. Misinformation spread rapidly on social media, creating deep divisions over masks, vaccines, and lockdowns. However, technology also allowed for new forms of connection. Families used video calls to stay in touch, and communities organized online to support each other. The pandemic forced us to rethink how we interact and what it means to be a community. Life after each pandemic was never quite the same. The Spanish flu was strangely forgotten for many decades, overshadowed by the war. Yet it had lasting effects, contributing to the rise of public health systems in many countries. COVID-19, on the other hand, has sparked immediate and widespread changes. It accelerated the shift to remote work, making it a permanent option for many companies. It also brought mental health to the forefront of public conversation, as millions struggled with the stress of isolation and uncertainty. Employers began to offer more mental health support, recognizing its importance for a healthy workforce. These changes show how a global crisis can force society to evolve in unexpected ways. The scientific response to the two pandemics could not have been more different. In 1918, scientists did not even know for sure that influenza was caused by a virus. They could see its effects, but they could not see the enemy itself. Without this basic knowledge, they could not develop effective treatments or vaccines. The main tools were non-pharmaceutical interventions. Media Group, 1918 quarantine notice. People wearing masks during Spanish flu. Closed public gathering places in 1918 at stock, at distribute_equally. Quarantine, good hygiene, masks, and banning public gatherings. These measures helped, but their effectiveness depended entirely on public cooperation. Doctors could only offer supportive care for symptoms, while secondary bacterial pneumonia, a common complication, was often a death sentence in a world without antibiotics. Science was largely powerless against the virus itself. Fast forward to 2020, and the scientific landscape had been transformed. Within weeks of the first reported cases of COVID-19, scientists had identified the novel coronavirus and sequenced its entire genome. This incredible achievement allowed researchers around the world to start working on diagnostic tests and vaccines immediately. Using new mRNA technology, multiple safe and effective vaccines were developed in less than a year, a process that used to take a decade or more. This was a monumental triumph of modern science. We also had antiviral medications and better treatments to help patients in hospitals. Science provided us with powerful weapons to fight the virus directly, something the generation of 1918 lacked. Communication from leaders also differed greatly, with mixed results in both eras. During the Spanish flu, many governments, focused on wartime morale, deliberately downplayed the threat or even censored news about the outbreak. This created a vacuum of information that was filled with fear and rumors. The public often felt abandoned and confused, leading to widespread distrust of authorities. This failure to communicate honestly and transparently likely made the pandemic worse, as people did not take the necessary precautions. A lack of clear guidance meant that responses were often chaotic and inconsistent from one city to the next, costing many lives. During the COVID-19 pandemic, we had the opposite problem: an overwhelming flood of information. Leaders and health officials held daily press conferences, and news was available 24/7. While this was better than silence, it also created new challenges. The science was evolving quickly, leading to changing advice on things like masks and transmission, which some people found confusing or contradictory. This environment was exploited by those who spread misinformation and disinformation online, eroding public trust. The lesson here is clear. Effective pandemic communication is not just about providing information. It must be clear, consistent, and empathetic to build and maintain the public trust needed for a successful collective response. The COVID-19 pandemic taught us crucial lessons that we must not forget if we want to be prepared for the future. One of the most important lessons is about the power of preparedness. The pandemic exposed weaknesses in our public health systems, supply chains, and global coordination. Countries that had invested in pandemic preparedness plans before 2020 generally fared better. We learned that the cost of prevention is far less than the cost of responding to a full-blown crisis. This means we need permanent, well-funded organizations dedicated to health emergencies, not temporary measures that are dismantled after the crisis fades. We must treat pandemic preparedness as a matter of national and global security. Another key lesson involves equity. Both the Spanish flu and COVID-19 showed that pandemics do not affect everyone equally. They hit the most vulnerable populations the hardest: the elderly, those with pre-existing conditions, low-income workers, and marginalized communities. During COVID-19, we saw how access to testing, treatment, and vaccines was often unequal. For future pandemic responses to be effective, they must be equitable. This means ensuring that everyone, regardless of their wealth or where they live, has access to life-saving resources. Global cooperation is essential to make sure that vaccines and treatments are distributed fairly, not just to the richest countries. A virus anywhere is a threat everywhere. The pandemic also transformed our understanding of work, technology, and mental well-being. The rapid adoption of remote work showed that many jobs can be done flexibly, which has changed employee expectations forever. Companies learned the importance of resilient supply chains and digital technology. Just as importantly, the shared trauma of the pandemic brought mental health out of the shadows. We learned that supporting the psychological well-being of citizens and employees is not a luxury but a necessity during a crisis. These lessons in resilience and adaptation can help us build a more flexible and humane society that is better able to withstand future shocks. Finally, the most important lesson is the danger of forgetting. After the Spanish flu, the world quickly moved on, and the pandemic became a forgotten chapter of history. This collective amnesia left future generations unprepared. We are at risk of making the same mistake with COVID-19. As daily life returns to normal, it is easy to push the hard memories aside. But we must actively remember what we went through and the lessons we learned. We must study what went right and what went wrong. By keeping the memory of these pandemics alive, we honor the victims and empower ourselves to build a safer, more resilient world for the generations to come. History has given us a clear warning. We must choose to listen,